My focus and the current focus of our center is on men's urinary and pelvic health, and we need to do whatever we can to allow men to be actively involved in taking care of their health. We need those who care for those men and who are important in their lives to understand as well what is necessary to allow a man to maintain health in this vital portion of his body. Well, how are we going to do that? So I invite you to watch our videos currently on our website and on other sites to explain the mechanisms involved, the concepts involved in men's urinary and pelvic health. We're going to use things as simple as these common pantry items to try to make something that seems on the surface to be way too complex into something very accessible. Because only if a man and those who support the man and those who care for the man understand these things, then a man has no chance of fighting and preserving the best health possible. No, this is not another cooking video. I'm trying to figure out ways of explaining how the whole urinary system works in men. It's really difficult to expect a man to come up with some sort of a reasonable decision about what sort of therapy he wants when he's starting to have prostate-related problems, when the whole concept of how the system works is unclear to them. We still have this notion that the body is something different, so that I can have guys sitting in front of me who work on big engines, they're engineers, they can fix anything put in front of them, but when it comes to talking about how the body works, they somehow think that this is of another, and they have difficulty trying to put together the concepts. The truth is that the body makes sense, and the body works by the same physical principles that everything else around us works by. To try to understand this a little bit better, I was looking around my house to try to assess what in our daily living can represent what goes on in the bladder roughly. So I went through our pantry and I pulled out these things. Despite the different architectures of the different bottles, they all have the same properties. If you want to have something that holds fluids or liquids, but then you want to be able to then disperse them, you have to have something of this design. You have a wider area that actually holds the liquids, but then it starts to narrow down, tapers down, as we start to engage the mechanism of the fluid being expelled. If we didn't have that, if we just kind of pictured making a cut over here, cut over here, cut over here, cut over here, and we turn things around, there would be no control. Things would just gush out. In addition, if we want to put in a system of better control, then we have to have taper so that we allow gradations of fluid coming out. So again, in our daily lives, what goes on in the bladder makes sense in what our normal reality. So if we're going to have a system in the body that's involved with holding fluids, such as the bladder with urine, and expelling it, which means going through a tube which involves prostate and urethra, we have to have this sort of architecture. We have to have something wide that then tapers into something narrow. Now, to put this into anatomic terms, we'll show and we'll start introducing true anatomic videos and pictures, but try to pretend that when we talk about a bladder, it's going to have to be something like this. And then we talk about the bladder neck or the opening to the bladder, it's going to be something that begins to taper down like this. And if we talk about the prostate, it's going to be this area over here. And then we can start understanding that if different insults occur to any of these areas, how it's going to impact how the fluid comes out, how it's going to impact the urination of a man. And if we're going to make decisions, for instance, about what surgery to accept, we're going to have to say, well, how does that surgery impact these different areas? If you keep that in mind, now it's no longer a secret. Now it's no longer something that only a few people understand. Now it's readily understandable, and you can come to the logical conclusions that make sense for you.